Epigastric Hernia Repair Laparoscopic. Introduction. The stomach helps digest the food we eat. Select true or false. Correct. The stomach and intestines are inside the abdomen. They help digest the food we eat. Epigastric hernias happen because of a defect or weakness in the abdominal walls. Select true or false. Correct. The weakness in the muscles could be the result of lifting heavy objects. If the surgeon decides it is safer, he or she may switch from laparoscopic surgery to an open surgery. Select true or false. Correct. In some rare cases, a surgeon may need to switch to an open surgery. An open surgery is done with one large incision over the hernia. Can a hernia happen again after surgery? Select yes or no. Correct. The hernia could happen again. This may require additional surgeries. Laura had epigastric hernia repair surgery yesterday morning. She now has a fever of 102 degrees Fahrenheit, 38.9 Celsius, and redness around her incisions. Medicines are not helping improve her pain. Should Laura contact her healthcare provider? Select yes or no. Correct. A high fever, redness around the incisions, and pain that is not relieved by medications may be signs of a problem. Laura should contact her healthcare provider. Thank you for using Explain.